And then one of the big problems is that there's no oversight to any of these medications. The FDA doesn't look at this. You go to the GNC store and get a bottle, you really don't know what's in it. You don't know the quality of it. You don't know the effectiveness of it and how reliable it is. So I always say buyer beware. It's funny and frightening at the same time. I will have patients come in and grill me when I try to give them a medication, and rightfully so. So, you really should be careful what you put in your body, but they'll ask me, well, is this Proscar, what does it do? Is it effective? How much is it going to cost me? What are the side effects? And then they go out to GNC and buy a $150 bottle of something that because it says herbal and natural, it's safe. It's not always the case. Okay, so I say, who do you want prescribing your medications, the doctor or the gentleman at the mall at the GNC store? Well, just, you got to be careful. These are prostatic stents. We're sort of moving on to some of the surgical type solutions. They used to be more popular, then they sort of waned, and now they're becoming a little more popular. There's some improvements that are being made. They're basically a stent that goes along the prostate. They can be uncomfortable, but some patients find it very helpful, especially if you're on a lot of medications or can't tolerate the side effects. There are newer minimally invasive treatments. Transurethral microwave therapy. It's basically a catheter that goes inside the urethra. This area right here heats up and, for lack of a better word, melts the prostate and opens up that channel. There's a tuna procedure, which basically there's a catheter that we insert with two little antennae at the end. We stick those into the prostate and heat it up using radio frequency waves. We're not exactly sure how it helps, but there are some theories and some studies that we think it literally shrinks the prostate some, which acts a lot like the Proscar and the Avodart, but we also think it kills those alpha receptors, a lot like the Flomax. So, this is sort of a substitute for the medications, and there's some good data that support that too.
Do any of these last three therapies affect the purpose of the prostate?
Affect the what, I'm sorry?
The purpose of the prostate.
Purpose of the prostate, yes.
Okay.
Yeah. But most of the people we are doing these on are no longer interested in having kids. Yeah. So they don't necessarily care or welcome it. The one on the left is the old Roto-Rooter. We still can do that. It's sort of the gold standard. You take a lube and it's like a hot knife through butter and sort of scrape out the prostate from the inside. Nowadays we do those with lasers usually. A lot safer, a lot less risk of bleeding. Typically 95% of the time you go home the same day. So there's a lot of advantages to the using lasers. And then lastly on the right, the open prostatectomy. Now that's not where we literally sort of core out the prostate, where we sort of, if you think of the prostate as an orange, we sort of scoop out the inside of the prostate, of the orange, and leave the rind. It's not for cancer. This is not a cancer surgery. So when you hear prostatectomy due to cancer, that's a separate issue. This is just due to enlargement. Okay. That's obviously a lot more invasive. You got to stay a couple nights in the hospital.
How long does it take to heal from something like that?
Usually you're in the hospital 3-4 days. Have a catheter for a couple more. It is the most effective treatment because all that tissue's gone, but obviously it's a lot more invasive. You have a nice incision, a lot more risks of bleeding, transfusions, risks of being in the hospital for several days. There are a lot of risks of that, pneumonia, blood clots, all that sort of stuff. But it may take a couple weeks before you're sort of back up to 4 to 6 weeks before you're back up to 100%. Not that you're going to be in bed that long, but it's not a quick recovery. It's a big procedure. We don't do it a whole lot. Usually the prostates we do that for well over 100 or close to 100 to over 100 grams.
So it's major surgery.
It's major surgery, yeah.
So this translucent thing which you're saying, does it also reduce the risk for prostate cancer because you're taking
No. Again, this is nothing to do with prostate cancer. In fact, you should, anyone that you're sort of working up for that, you really need to rule out prostate cancer before you do it. Now, sometimes we do it in men that do have prostate cancer already diagnosed, and that's okay as long as you do it for the correct reason. So if you come with me and you have been diagnosed with prostate cancer, and you've already had radiation treatment or already had seeds or something like that, but you are having symptoms because you have too much tissue there, that's okay to go in even though you have prostate cancer and perform it. But if you're coming to me and you're 55 and you're having issues, my job is to make sure there's no cancer there first before I do it.
If you have surgical removal of the tissue, that turf or something, how long does that usually last? Is it recurring again? The tissue going to grow back?
It can, absolutely. The gold standard is the old roto-rooter with the loop. Ideally, it's a one-time procedure. That's what the goal is, that you resect enough tissue where it's a one-time procedure, but there's no guarantee. It may last 5 years, 10 years, 20 years, but sometimes we do need to repeat it. Absolutely. And it can grow back.
Are the side effects lessened with laser as opposed to being?
It depends who you ask. If you ask the laser guys, yes. Now, the major side effects of hospitalization, the catheter usually is in for a shorter period of time, bleeding, those things are less, yes. There is still a risk of stricture formation or scar formation. There's a risk of injuring the ureters, which are the tubes that bring in the urine to the bladder. There's a risk of incontinence, although that is less. So, for the majority of the side effects are less, but there are some that are the same. All right, so any other questions on enlargement? We'll move on to prostate cancer. 10 till 8, so I don't want to keep everybody here too long. American Cancer Society, 32,000 men will die every year of prostate cancer. Those are the 2010 numbers. This is an interesting slide. The most common, prostate cancer is the most common non-skin diagnosed cancer. It's the second leading cause of cancer-related death, secondary to lung cancer. And you can see that graph right here on the left. Leading cause of death, cancer death, second behind lung cancer. Now, there is an extremely controversial, there's a lot of controversy regarding prostate cancer screening. Should we be screening? How aggressive should we be screening? And there's pros and cons to both sides of the argument, but if you look at this, the rate of death between prostate cancer and breast cancer is basically the same. And the controversy regarding breast cancer, although there is some, is much, much less. So just sort of interesting when you look at it that way. As a whole, 1 in 6 men get diagnosed with prostate cancer. So you have a 1 in 6 chance of getting diagnosed with prostate cancer in your life. Of those 1 of 6 die from the disease, okay? The problem is we don't know the 1 that's gonna die from the 5 that are gonna live. That's sort of the holy grail as well. If we had some test to say, okay, you 6 guys are diagnosed with prostate cancer, but you're the only one that's gonna die, we just need to treat you. The other 5 live a nice normal life. We don't need to worry about you. We don't have that answer yet. Okay, that would be terrific.
The deaths, do they occur directly because of the prostate cancer or because of the cancer metastasis?
Cancer metastasis. Okay. Prostate cancer can be treated and it can be cured. The majority of men live a nice normal life. Again, 1 in 6 die. The other 5 live a normal life. Would live a normal life.
Is it true they say that in prostate cancer, the cancer grows very slowly?
Typically, yes. Now, not all cancer does that. Not all prostate cancer does that, but the majority does. Absolutely.
So are you saying you don't have small cell cancer in prostate cancer?
Say that one more time.
The small cell cancers are the ones that multiply.
Small cell cancer?
Right, you don't have.
Small cell cancer is sort of a different beast in that it's not a slow growing one.
That's what I'm saying. Does it occur in prostate cancer?
Does small cell cancer occur in the prostate?
Right.
It can, yeah.
Okay.
Very rare, very, very rare.
Okay.
But prostate cancer is sort of, for the most part, we think it kind of come in at least sort of 2 categories, even though we categorize it differently. But there's kind of a very aggressive type of cancer where if you get the aggressive cancer, no matter really what treatment, you're not going to do too well. Versus the slow-growing cancer, where no matter what treatment you do, you're going to do pretty well. That's kind of, as we're learning, that's sort of what we're learning.